blood from left coronary arteries (LCA) and right coronary arteries. The left coronary artery arises from the left aortic sinus at an acute angle from the aorta as a single short main artery, left mainstem. The LCA bifurcates to form the left anterior descending artery, LAD, and left circumflex. The LAD anastomoses with the posterior descending artery, PDA, a branch of the right coronary artery, RCA. The LAD supplies the interventricular septum, anterior 2/3, the apex, and the anterior aspects of the right and left ventricle. The LCX has a major branch, the left marginal artery, and in around 10 to 15% of the population, the LCX anastomoses with the RCA to give rise to the PDA. In general, the LCX supplies the posterior aspect of the left atrium and superior portion of the left ventricle. The RCA arises from the right aortic sinus and has major branches such as the PDA supplying the posterior third of the interventricular septum and AV node. The nodal artery, supplying the right atrium and the SA node, and the right marginal artery, supplying a portion of the right ventricle, the inferior left ventricular wall, and the PDA. In the majority, 80 to 90% of cases, the RCA supplies the atrioventricular node, AV node. Finally, the coronary arteries branch into small arteries and arterioles. These vessels terminate in end arteries that supply the myocardial tissue with blood. In general, the RCA is dominant in 60 to 65% of cases, because it gives off a PDA branch balanced coronary circulation. In about 10 to 15% of cases, the LCX gives rise to the PDA left predominant circulation. In 20 to 25% of cases, the RCA, in addition to supplying the PDA, crosses the posterior interventricular septum to reach as far as the left marginal artery and thereby supply the diaphragmatic surface of the left ventricle, right predominance. However, this term does not distinguish this condition from balanced coronary circulation. Venous circulation. The venous circulation of the heart is from the coronary sinus, anterior cardiac veins and the lesser cardiac, division veins. The coronary sinus receives most of the venous return from the epicardium and myocardium, and it opens into the right atrium between the opening of the inferior vena cava and the right AV valve. The coronary sinus gives rise to tributaries such as the great cardiac vein, middle cardiac vein, smaller cardiac vein, and oblique vein. The great cardiac vein drains the anterior portion of the interventricular septum and anterior aspects of both ventricles. The middle cardiac vein drains the posterior portion of the interventricular septum and posterior aspect of both ventricles, and the smaller cardiac vein drains the marginal aspect of the right ventricle. The division veins drain the endocardium and the innermost layers of the myocardium directly into the underlying chamber. Cardiac valves and cardiac skeleton. Tricuspid valve. 1. Tricuspid valve. Right atrioventricular valve connects the right atrium and the right ventricle. 2. Composed of 5 components: annulus, leaflets, commissures, chordae, tendinei, papillary muscles. 3. Anterior tricuspid leaflet is the largest, most mobile, and the posterior leaflet is the smallest. 4. Tricuspid valve has a triangular orifice. Mitral valve. 1. mitral valve. Left atrioventricular valve connects the left atrium to the left ventricle. 2. Composed of 5 components: annulus, leaflets, commissures, chordae, tendinei, papillary muscles. 3. Composed of 2 leaflets only. 4. Anterior tricuspid leaflet is large, semicircular and twice the height of posterior leaflet. 5. Posterior leaflet is rectangular and is divided into 3 scallops. 6. Mitral valve has an elliptical orifice. Aortic valve. 1. Aortic valve, semilunar valve, opens between the left ventricle and the aorta. 2. Composed of 3 components: annulus, cusps, commissures. 3. Composed of 3 semilunar cusps. Pulmonary valves. 1. Pulmonary valve. Semilunar valve regulates flow between the right ventricle and the pulmonary artery. 2. Composed of 3 components: annulus, cusps, commissures. Cardiac grooves. 1. Atrioventricular AV groove separates the atria from the ventricle. 2. Anterior and posterior interventricular IV grooves separate the ventricles. 3. Right coronary arteries (RCA) travel in the right atrioventricular groove. 4. Circumflex artery (CX) travels in the left atrioventricular groove. 5. The left anterior descending artery (LAD) travels along the anterior interventricular groove. 6. Posterior descending artery (PDA) travels along posterior interventricular groove. Cardiac crux, external and internal. 1. External cardiac crux is the intersection between the AV, posterior IV, and interolateral IA grooves. 2. Internal cardiac crux is the posterior intersection between the mitral and tricuspid annuli and the atrial. And ventricular septa. Cardiac margins. 1. Acute margin, junction between anterior and inferior wall of the right ventricle. 2. Obtuse margin, rounded lateral wall of left ventricle. Coronary arterial circulation. A. Left coronary artery, LCA. 1. Ostium of the left coronary artery originates from the left aortic sinus. 2. LCA arises at an acute angle from the aorta. 3. LCA courses to the left and anteriorly, left anterior descending artery, LAD, and after variable length gives rise to left circumflex artery, LCX. 4. Diagonal artery may arise between LAD and LCX or from the LAD. 5. LAD continues towards the septum and gives rise to septal perforator branches. B. Right coronary artery. 1. Arises from the right aortic sinus. 2. Major branches are nodal right marginal, PDA. 3. Supplies the RA node, part of RV, posterior, third of the interventricular septum, AV node and right branch of the AV bundle to his. C. Left circumflex artery, LCX. 1. Originates from the LAD and courses variable. 2. May terminate into one or more large obtuse marginal branches. 3. May continue as a large artery and give rise to posterior descending artery, PDA. 4. When the left circumflex artery supplies the major PDA, it is referred to as a dominant artery. Coronary venous circulation. 1. Composed of the coronary sinus, cardiac veins, and the Bayesian venous system. 2. great cardiac vein and other cardiac veins, left posterior and middle, drain into the coronary sinus, and finally empties into the right atrium. 3. Rarely the coronary sinus drains directly into the left atrium. Coronary collaterals. 1. Provide communication between major coronary arteries and branches. 2. May dilate and provide blood supply beyond the obstructed, stenosed epicardial vessel. 3. May develop between the terminal extension of two arteries, between side branches of two arteries, between branches of same artery or within the same branch. 4. Most common in the ventricular septum, ventricular apex, anterior right ventricular free wall, anterolateral, left ventricle free wall, cardiac crux and atrial surfaces. Cardiac lymphatics. 1. Lymphatics drain towards the epicardial surface and they merge to form the right and left channels. 2. Left and right channels travel in a retrograde fashion with their respective coronary arteries. 3. The left and right channels travel along the ascending aorta and merge before draining into the petricial lymph node. 4. The merged single lymphatic chain travels through a cardiac lymph node and finally empties into the right lymphatic duct. Great vessels. 1. Subclavian and internal jugular veins join together bilaterally to form right and left innominate brachiocephalic veins. 2. Right and left longer innominate veins join together to form superior vena cava (SVC). 3. SVC receives azygous vein before draining into the right atrium. 4. Thoracic aorta arises at the level of aortic valve and is made up of the ascending aorta, sinus and tubular portions. Aortic arch and descending aorta. 5. Aortic arch gives rise to the innominate, left common carotid and subclavian arteries. 6. Descending aorta lies adjacent to the left atrium, esophagus and vertebral column.